GV, Life Protected. How to use your urine and vomit spill pack. The GV Health Urine and Vomit or Bodily Fluid Spill Pack has been developed in accordance with the Health and Safety Executive, UK Department of Health and World Health Organization to ensure best practice procedures and safety when dealing with the following bodily fluid spills. For biohazard and blood spills, use our MJZ003 Biohazard Spill Pack or MJZ017 or MJZ018 Spill Kits. GV Health Spill Packs and Kits provide an accessible, easy-to-follow and safe solution to ensure best practice and compliance for spill cleanup procedures, providing all certified PPE and recommended active ingredients in one place. Put on the apron and gloves provided. Wear face protection if there is a danger of splashing. Unfold the yellow clinical bag and set it up as near to the spill as possible to ensure it is accessible for use during the later steps. Tear the top of the sachet of the absorbency granules and sprinkle all granules over the spill, ensuring it is completely covered. Allow for up to 2 minutes for the granules to absorb the spill. Using the scoop and scraper provided, remove the absorbed spill and surplus granules from the site and dispose into the yellow clinical bag provided. Place scoop and scraper into yellow clinical bag once all material from the spill site is removed. Open the disinfectant wipe packs provided. Wipe down the area of the spill site to disinfect and remove any residue of the spill, wiping in an S-shape motion. Dispose of used wipes in yellow clinical bag provided. Remove gloves first. Pinch one glove at the wrist without touching the skin of the forearm and peel away from the hand, turning the glove inside out. Hold the removed glove in the gloved hand. Hook the index and middle finger of the bare hand inside the remaining glove, taking care not to touch the outside of the glove. Pull off the glove, turning it inside out with the first glove inside. Dispose in yellow clinical bag provided. To remove apron, break the neck loop and waist straps. Avoid contact with the outside of the apron. Roll the apron downwards from your chest so the contaminated outer surface is folded inwards. Avoid touching the outer surface of the apron with your hands. Dispose in yellow clinical bag provided. Close bag, ensuring you do not touch the inside. Tie a knot and place bag into appropriate waste stream in accordance with local regulations. Wash hands thoroughly after procedure is complete. GV, Life Protected.